So I think most of you on here know me. My name is Sam Petto. I'm the communications director at the ACLU of Nebraska. My pronouns are he, him, his, and we are less than a week out from the Supreme Court overturning Roe v. Wade and 50 years of federal protections to the constitutional right to seek abortion care. Today, we are looking to highlight different organizational partners and voices to turn focus to the people who are most impacted by these bans, the groups, what we would see in Nebraska if anti-abortion politicians were successful in pushing through a total ban and ending Nebraskans' rights to make decisions about their own lives, their own bodies, and their own futures. And so you're going to hear from Candy Jones. She's the board chair of Survivors Rising. You'll hear from Naomi Thompson, IB Black Girl Policy and Advocacy Manager. And you hear from Abby Swatsworth, Out Nebraska's Executive Director, Angela Montalvo, Poor People's Campaign Coordinating Committee Tri-Chair, and Morgan Ryan, Nebraska Youth Advocate. And after that, we'll have a chance for questions. I don't think this will go any longer than 30 minutes, but we'll make sure that you all can get your questions answered. So with that, I'm going to turn things over to Candy.
Thank you. I'll start by saying speaking today comes with a range of emotions. I am absolutely gutted and horrified at this recent overturning of Roe versus Wade, yet we are all here and we're ready and willing and determined to speak up and out. Survivors Rising speaks up and walks with survivors. So what that means is we support survivors post-crisis. And many times that means so many things to the individual having the experience. This means that we will advocate for the rights of survivors to make informed choices about their bodies, their medical care, and their healing. It is their choice. It is their right. And we can't sit back while this decision has the potential to harm millions of people, and in some cases already has done harm. Access to safe legal abortion is a right for everyone, but for Black women who are victims and survivors at alarming rates of domestic violence, sexual assault, and human trafficking, this decision impacts us greatly. Maintaining the rights of Black, Indigenous, and other people of color remains a top priority of ours, and we will continue to stand at the forefront, advocating for the reproductive rights and justice for those most impacted by these abortion bans. What we know is that reproductive coercion, forced pregnancies, and rape resulting in pregnancy are all risk factors, and it happens in the communities we serve. But we just want to make it clear and help bring awareness to the fact that these forms of abuse are among the most underreported crimes in the US. But even if it happens to one, that is enough, but we know it happens more often than that. We know as survivors and as advocates in this work that when you take away the options and choices, you are taking away control and safety. What we want to make clear is that domestic violence is already one of the leading causes of death for Black women at between the ages of 15 and 35. And without access to safe and legal abortions, Black women survivors will be further trapped in the cycle of abuse and will die at even higher rates at the hands of their abusers. If one woman dies because she did not have a choice, that is enough, but we know that it happens more often than that. And also there are 3 million women that we are aware of, many of this goes unreported, that have experienced rape-related pregnancies, and that means carrying a pregnancy to term may not be a safe option for all people. Sexual violence is extremely complex and difficult to navigate, but what we know is that the impact is devastating. We have seen it, some of us have experienced it, firsthand the trauma of sexual violence and what it means to lose complete control over your own body. Families are at risk, children are at risk, entire communities are at risk simply because victims have lost their right to choose. Things can and often do escalate during pregnancy. What we know in communities that we serve is that abusive partners control everything that they can. What that means is that if an abused person cannot even go down the street to the grocery store, you tell me how they would go across the state to get the care that they need. It is clear to us that by ending legal abortion has most certainly set us back in the worst way. Reproductive choice cannot be limited to victims of sexual violence and intimate partner violence. We stand with those that need this choice for any number of reasons, personal to them, private to them, for reasons only known and understood by them. We stand with those whose pregnancies are not viable and whose own health is at risk. We stand in solidarity with those that aim to protect women's health and reproductive rights. Thank you for your time today.
Thank you, Candy. Next up, we are going to hear from Naomi Thompson with IB Black Girl.
Hello, everyone. My name is Naomi Thompson. I am the Policy and Advocacy Manager of IB Black Girl, and my pronouns are she, hers. I'm representing I Be Black Girl, which serves as a collective for Black women, femmes, and girls to actualize their full potential to authentically be through autonomy, abundance, and liberation. I Be Black Girl is a reproductive organization working to ensure there is reproductive freedom for Black women and folks with a reproductive system, which includes abortion access. Black women and folks with reproductive systems have been afflicted for centuries by policing and harm to our bodies, exacerbating already existing racial disparities in healthcare by removing or limiting abortion care will not be tolerated. There are several factors that may go into a person's decision to seek an abortion, and there is no right reason for accessing abortion care. If a person wants one, they should have access to have one. Forcing people to carry pregnancies will add to the maternal health crisis Black birthing people are already experiencing. In Nebraska, Black birthing people have the highest rates of maternal deaths and nationally are 3 times more likely to die from childbirth than white folks. On top of this, Black women and birthing folks are also at a higher risk for pregnancy complications and postpartum issues such as preeclampsia and eclampsia. A patient's health should drive important medical decisions, not a politician's beliefs. Each of us should be free to make the decisions that are best for our lives. When people can do this, we build communities where each of us can participate with dignity. Thank you for your time, and I'm looking forward to your questions.
Thanks, Naomi. And next up, we're going to hear from Abby Swadsworth, Executive Director of Out Nebraska.
Thank you, Sam. Thank you for being here today as a part of this press conference. It is really important that we hear this variety of voices and what we are bringing to the table today. Again, my name is Abby Swadsworth. I am the Executive Director of Out Nebraska. Out Nebraska is a statewide organization working to celebrate and empower LGBTQIA2S+ individuals across our state, and that includes their reproductive rights and reproductive health care access. This is very much an LGBTQ+ issue. There are members of our community who would be impacted, who are impacted by this potential ban. We are working and will continue to work to make sure that abortion is safe and legal in Nebraska. In a world where transgender and non-binary people are already facing significant healthcare barriers, putting another barrier to their care is not acceptable. We stand with all people who have a reproductive system, which is all of us, men, women, transgender folks, non-binary femmes, and masculine people are all impacted by this, and we must stand together. We must look at the potential fallout of our access to sexual intimacy, contraception, and same-sex marriage that may follow on the heels of this turning away of precedents. There is so many things that we could say, and I must say I agree with Candy that I am heartbroken and tired. This fight has been so long going, and we're continuing the fight. We will stand up. We will be a part of making sure that Nebraska keeps abortion safe and legal. You know, there are so much violence towards transgender folks, especially transgender women who are Black and brown, and towards transgender men who can still become pregnant. This is an issue that we cannot turn away from, and that we will take up the fight and continue the fight. I look forward to your questions, and thank you for the opportunity to speak today.
Thank you, Abby. We got 2 more speakers before we get to questions. One group we've talked about being impacted are both rural Nebraskans and Nebraskans struggling financially. And our next speaker, Angela, is with the Poor People's Campaign, the Nebraska Coordinating Committee Tri-Chair.
Hi, everybody. My name is Angela Montalvo. I am a tri-chair of the Nebraska Poor People's Campaign, and I would like to echo the words of our national co-chairs, Bishop William Barber and Reverend Dr. Lizzo Harris, as well as our policy director, Shiley Gupta Barnes. On Friday, June 24th, an extremist majority of the U.S. Supreme Court overruled more than 50 years of legal precedent, taking away a previously recognized fundamental right for the first time in the court's history. In doing so, it unleashed the full force of a regressive, coordinated state-by-state attack on the already perilously eroded right to access abortion, on women's rights, the human right to bodily autonomy, privacy, and control over our own lives and dignity, and to life-saving healthcare and freedoms. We are not sounding a new alarm. The nation's 140 million poor and low-income people, including 74 million women and girls, have been declaring this emergency in the face of an all-out attack in courts and extremist legislatures across the country, including Nebraska. The immediate and long-term impact of this decision in Dobbs versus Jackson will be disproportionately felt by poor women, women of color, transgender, and gender nonconforming people, all of whom already face increased healthcare disparities and economic insecurity. In Nebraska, 39% of women are poor or low income. As of 2015, 85,000 children in Nebraska lived in food insecure households. That's 18% of all children in the state. 19% of children in Nebraska had parents without secure jobs as of 2016. That's 91,000 children. If abortion were to become illegal in Nebraska, an unfair burden would be placed on these women and families. People will have to leave the state to access abortion care, and in many cases have to travel hundreds of miles. For poor and low income people, that is simply not an option. Forcing women to bear children when they may be struggling to care sufficiently for themselves and their families will have enduring consequences. And expecting a child in poverty to bear a child, aside from being morally wrong, is a tremendous risk to their entire family and can disrupt any chance of lifting that child out of poverty. As Frederick Douglass said on the passage of the Dred Scott decision in 1857, in one point of view, we, the abolitionists and colored people, should meet this decision, unlooked for and monstrous as it appears, in cheerful spirit. This very attempt to blot out forever the hopes of an enslaved people may be one necessary link in the chain of events preparatory to the downfall and complete overthrow of the whole slave system. The whole history of the anti-slavery movement is studied with proof that all measures devised and executed with a view to diminish the anti-slavery agitation have only served to increase, intensify, and embolden that agitation. This is not the time to step back. It is the time to step up. Forward together and not one step back. Thank you for your time.
Thank you, Angela. Our last speaker before we get to questions is Morgan Ryan, and I will pass things over to Morgan.
Hello, everybody. My name is Morgan Ryan, and I'm a recent high school graduate in Omaha. I'm also a former member of the Omaha Teen Council, which is a peer health education group for high schoolers with Planned Parenthood. And I'm here today to talk about the effects an abortion ban would have on young folks in this state. We shouldn't look at the action of banning abortion in a vacuum. It can't be ignored that those championing Friday's tragic decision are the same exact people trying to take away all the tools Nebraskans have to prevent unwanted pregnancies. Together, this is a coordinated attack on bodily autonomy, and it will hit young people the hardest. Anti-abortion leaders want to ban us from learning about our own bodies in school. Then they come after our birth control, and now they want to sentence children and teenagers to parenthood against their wills. Nebraska youth already face substantial obstacles to seeking the abortion care they need. If abortions become banned in the state, the crucial medical care would be put out of reach for too many young folks who need it. Our leaders often ask why so many young people cannot wait to get out of Nebraska. The truth is that the culture here, headed by our state government, is toxic towards young people, students, and particularly towards young women. We are tired of having our government say that we're too incompetent to make our own medical decisions. Young people don't want paternalism. We want the freedom to make our own choices about our own bodies. Polls show that Gen Zers support abortion rights more than any other generation. Imagine what will happen to the state's brain drain problem when our world-renowned medical schools and hospitals become unable to train OBGYN residents to accreditation standards because of an abortion ban. Employers and universities will struggle to recruit new talent because nobody wants to live in a state where politicians get a say in their health care. Abortion bans are bad for youth attraction and retention, period. But radical anti-abortion activists are not just coming after our abortion rights. This past session, they came within 2 votes of banning all abortions, IUDs, and irreparably harming the IVF process that so many Nebraskans rely on to build their families. I'm particularly concerned about what criminalizing birth control would mean for the young women in our state. 82% of teens who use hormonal birth control do so solely or partially as treatment for what can be debilitating medical conditions. I am one of these people. Anti-abortion politicians want to prioritize hypothetical fertilized eggs over real, breathing, suffering human beings like myself, and they almost succeeded. The banning of abortions and birth control would be devastating for the aspirations and life goals of many young people in our state, as well as our ability to gain high school and college degrees. We are passionate about this issue, and we are ready to lead the fight on any such ban on our reproductive health care. Thank you for the opportunity to speak today.
Okay, thank you, Morgan. We're going to get to questions. We'll read Andrew's first, and then after Andrew's, if folks can continue to either pop them in chat or come off mute to ask those questions. The first question, and Candy, maybe this is your arena given your work, is how concerned is this group that Nebraska lawmakers will present a total abortion ban bill that would include an exemption for rape and incest and risk of life of the mother to get it passed in special session?
Well, I'll be clear. I think that all of us here are against any ban of any kind that violates the reproductive rights of anyone. And the reason we say that is because in this work, it needs to be clear that a lot of rape, a lot of crime, as I mentioned earlier, goes unreported. So what you're doing is you're setting the stage for folks that may not even feel comfortable sharing what's happened to them, may not even grasp what's happened to them, may not even know that rape is what occurred in that moment because they're traumatized, to make an informed decision about their health. Any ban on any right is a ban that we can't allow to happen. I mean, we just can't allow anyone to make a decision about how we choose to show up and how we choose to handle our lives and how we choose to handle our trauma. What that is saying is that you're saying you will control how someone chooses to handle their trauma. And that is just taking things to another level. So my answer to that is simple, that we are against any ban of any kind, against any reproductive right.
Thanks, Candy. We had a question come in directly, and maybe this is a good one for Naomi. Can someone talk more about how an abortion ban would further the systemic issues that BIPOC women already face?
Yeah, I think when it comes to that, it's very pertinent to the financial piece that was mentioned. Black women make on average $27,000 in Nebraska, which would lead to the food and housing being inaccessible, pushing people further into poverty. Forcing someone to have a kid who is not financially able to would further put Black women behind. So.
Thanks, Naomi. We have a question from Paul. Perhaps this is something folks can speak to. Otherwise, we can follow up with a referral. This helped me better understand how training of OBGYN docs might be impacted. Is there anybody on this group that wants to tackle that? Otherwise, we'll find you the right person later, Paul.
I can speak a little bit about it. So by my understanding, residential OBGYN programs are required as of now to provide some abortion training. It's not required for residents, but programs are required to provide that training. So some of those groups are concerned about having to maybe pay extra money to send their students across the state to a place that can train them. And that's just another cost on top of how expensive it is to go through medical treatment and care.
Two more questions that came in directly, and these ones might be headed back towards Candy and Naomi if they're willing. It's a two-part question. The first is, what can the legislature do to ease issues if they vote for a ban? This, I think, on some of those effects that we were talking about of a ban. And again, we all remain absolutely opposed to any ban and any restriction on people's reproductive choices and freedom. But the second part of that question, and this is what I think is maybe Candy or Naomi question is, what can BIPOC women do, if anything, if a ban came through?
Well, obviously, in this moment, we are really working to prevent a ban from happening here in Nebraska and across our country in the spaces that it has already happened. All that we can do is honestly stand up and stand for and protect, provide the resources, give people the help they need right away, let people know the options that they have right away. The thing is, here's what I want to make clear is that this ban does not necessarily prevent abortions. What it does is prevent safe abortions. What this has done is it's created space for people to try to do and make decisions that are harmful and that will harm them and potentially their lives in order to just make a choice, right? So I want to be clear that we are not stopping abortions. What we're doing is creating climate for unsafe abortions. And that is what we want to prevent. So I don't want to think about a day when bans are here in Nebraska. I don't, and I want to fight against that. But what we will do is we will do what we can to make sure the resources are available, that we can protect people, that we can provide the money. And again, Naomi mentioned that the financial resources are very limited already. So all we can do is provide the resources and the care and the opportunity to get people where they need to go to make the decisions that are best for them. So if an abortion is their choice, we will make sure they're able to do so.
Thank you, Candy. We had a question from Andrew on how far reaching the decision is and could it affect contraception? And I know Abby's statement, or one thing on her radar, has been just potential ripples. So Abby, maybe you can handle that question if you're willing.
Yes, thank you. We did see in Thomas Clarence's opinion on the case that he would like to further examine other existing precedent. And some of that precedent does have to do with the ability of people to access contraception. As we know, when contraception first came about, it was looked at as something only married people could access. And so there was case law developed so that people of all statuses could access contraception. And we've already seen a calling out at the court that they would like to re-examine that. So yes, we are very much concerned with a ripple effect of this ban coming down to access to contraception being impacted, and then also things like sexual intimacy and same-sex marriage all being on under the microscope of this particularly radical court.
Thank you, Abby. Couple series of questions that came in from Paul. Won't medical abortion provide a less expensive option for low-income women, or do you expect that to be banned too? You know, Paul, there was the effort to end the telehealth medication abortion ban last year, and you saw how that, or last session, and you saw how that went. So I see nods all around. I don't think there's anyone who would expect that medication abortion remains legal in the case in which a legislature is able to push through a total ban. Andrew has a question. On the flip side, could this decision someday allow a state which is overpopulated place regulations on how many babies people could have, like China did? So talking about government authority over people's reproductive choices. Is there anybody from the kind of reproductive justice perspective who wants to weigh in on what decisions belong to the state and the government and what belongs to individuals?
I'll just weigh in to say, if we do not have control over our very own bodies, we have control over nothing. We are not livestock. We are not machines to be ruled by other people. Those decisions always belong to the person who can be pregnant, to their medical provider, perhaps among family members and faith leaders, but those decisions are not to be made by the hands of government, should not be made by our governors, by our state legislatures, by politicians at any level. If we do not have control over our very own bodies, what can we control?
Thanks, Abby. This one directed specifically to Candy in the chat. How are organizations like you able to help women financially get access to abortion if there is a ban here?
I like to say it would be definitely a collective effort, right? Unfortunately, this is something that we have not seen in our time. So I think we're all scrambling to figure out the options and the resources and how we can protect women and their choices. I think that the state of Nebraska, if that's what we're speaking about, would need to collectively, the organizations that support this would need to collectively come together and figure out a way to make sure that the women in our state are protected and are able to go across wherever they need to go across to make the best decision and choice for themselves and their bodies. So while I can't specifically speak for our organization, what I can say is our organization will partner with the other organizations. We're stronger together to make sure that we can support women wherever they are. So, and this is something that we're already thinking about, right? Again, our goal is to stop it from happening. But should it happen, we will work together to figure out a way to make sure that women have access to the resources they need.
Thanks, Candy. And Paul, another reference for you or a referral is Chelsea with the Nebraska Abortion Resources Abortion Fund. They are a coalition partner of ours and could speak to that work that's already going on to reduce the financial barriers that already exist. Any other questions, folks? Pop them in chat or come off mute. Okay, well, we are coming up on 30 minutes. Appreciate everyone. You all know how to find us, so please do connect back if you have follow-up questions. Andrew, I'll email you the recording. And ditto, folks, if anybody else wanted that, email me. We appreciate your time, your diligent reporting on this topic, because we know a lot of Nebraskans and a lot of people care about it.